first study, which we're proposing for work package 1. It's building on currently SEI funded Senior Innovation project. There's a web link here which you can make a note of. That links you to a demo of what we've been doing and which you can have a look at. So what that is a questionnaire which we're looking at distributing around each of 6 centre locations. So that's York, Oxford, Tallinn, Stockholm, Bangkok and Nairobi. Participants, there should be 100 per site. We'll be answering questions about physical activity, about stress, subjective well-being. And these are all established, validated skills that have been used in psychological literature for a few years now.
Yeah, it's working now.
But we're also an opportunity to qualitatively talk about their own environments that they live in and how, for example, air pollution, crime might affect them on a day-to-day basis.
Yep.
So that's what we've been working on now, and that should be finished towards the end of the year. So what this first study, the initiative, would do would be to take those questionnaires and basically rerun them. But instead of doing them in these centre locations, we try and identify settlements or urban pop-up places that are kind of appearing, emerging at the moment. Try and understand if there's differences between an established urban population and people who are living in one of these kind of emerging urban settlements. So then we can kind of look in between. We can look between centre locations and within centre locations as well. So that would be the first port of call to establish this study method. And then we also use part of that to complement study 2. So the idea of these established urban spaces, there's a lot of literature in psychology at least, which suggests there's preferences and there's benefits of green spaces, natural spaces, in terms of restoring attentional fatigue, and just basically being a bit of a health benefit. But what hasn't been established is whether this is true in African and Asian context. A lot of these studies are done in Europe, in America, in Australia. So it'd be interesting to see if there are differences and why those differences might be occurring. So we can ask subjectively, we can ask people to fill out some of these scales as per study 1. We would also like to take some objective stress measures as well. So the picture on the screen there is a shimmer device. It measures a galvanomic skin response, which is just basically a biological measure of stress. Increased sweating, for example, increased blood flow through the capillaries there on the fingers. We'd like then to have participants walking between different types of spaces within urban spaces, within natural spaces. We'd also like people to be immersed in some of these spaces as well.
Hi, my name
One of the Urbanization initiative, so a few ideas around urban forms and their impact on community health and well-being. So work package 1 is interested in looking at links
So we're just waiting on technical support over here for our video presentations, but so thank you for joining us, but there'll be a slight lull.
Definitions of it could be physical, could be psychological, and there's ways that we can assess both health and well-being through subjective responses and through qualitative responses. Which brings me on to the first study, which we're proposing for Work Package 1. It's building on a currently SEI-funded Seed Innovation project. There's a web link here which you can make a note of. That links you to a demo of what we've been doing, and which you can have a look at. So what that is a questionnaire which we're looking at distributing around each of 6 centre locations. So that's York, Oxford, Tallinn, Stockholm, Bangkok, and Nairobi. Participants, there should be 100 per site. We'll be answering questions about physical activity, about stress, about subjective well-being, and these are all validated scales that have been used in psychological literature for a few years now. But we're also giving participants an opportunity to qualitatively talk about their own environments that they live in, and how, for example, air pollution, crime might affect them on a
decision makers. If well designed, there are many potential benefits to citizens.
Yay, success. Never work with children, animals, or computers. Okay, thank you all for being patient. Sorry for keeping you waiting while we have technical support. So I'm Steve Cinderby from the York Centre, if any of you don't yet know that. And this session is all about discussing the new potential urban initiative. So this is going to be very much an interactive workshop. You are participants in this process, hence you're on all these tables with flip charts. For those of you who know me, that means you're going to be working during this session. So we're really interested in trying to capture your knowledge and information about urban initiatives and potentials that we can connect to, in terms of the boundary partners we should be working with, the ongoing activities in this area that we should be aware of, and also potentially locations we could be working in where we could actually deploy the initiative if we move forward. So basically your city needs you and we need you in this process, so thank you for coming. So the structure of this, this session is going to be, we've got 4 different presentations. We've got Chris Neal from the York Centre, who's going to be talking about the impact of urban forms on health and well-being. That was one of the videos we got working. Rachel Pateman from the York Centre again, who's been looking at the potential for citizen science approaches to do participatory monitoring. And then in the room we have Dieter and Gary from York, who will be talking about participatory modelling and how this information from crowdsourcing could feed into that. And then finally, hopefully Niall's going to be saying some words around the potential around urban governance issues. So for those of you that saw my presentation yesterday, you'll be aware of all this, that the SDGs, the majority of them are inherently linked to the issue around urbanisation, and then we also have specific SDG around making cities inclusive, safe, resilient and sustainable to think about. And the reason this is so pressing is obviously because of this rapid growth of urban residents, with 60% of people projected to live in cities by 2030. And around 95% of that expansion is predicted to be in the developing world. So the focus at the moment for the initiative is going to be concentrating on our Africa and our Asia locations. So we're particularly interested in harnessing your knowledge about opportunities in those locations. And also in relation to those cities, a large number of people are living in informal settlements or slum dwellings. So it's how can we improve those conditions. This rapid rate of change is obviously putting huge pressure on those urban systems in terms of the supply of resources like water, that links to sanitation, but also the social systems around education and welfare, the natural environmental systems that still operate, and then how that all interacts with public health, including the mental health and well-being dimensions of living in a city. And these are all aspects that we want to be able to touch upon in the initiative going forward. So the common challenges that we've looked at in the past within SDI that I think we can bring to bear on this new initiative in developing country cities are around issues about mobility and congestion, and that links into that access to services in terms of education, healthcare. If you can't actually move and get to those places to access those services, you're excluded. How infrastructure is being put under pressure and actually declining in lots of cities rather than improving. The repercussions of use of resources in terms of things like air pollution, and then for many of those poorer communities, even access to basic services like water, having clean access to water and reliable access to water. So all those factors come into play in these urban systems, and I think that's where we need to touch upon. And I'm now going to hand over to Cecile for some local insight from Africa about a particular opportunity.
Hi everyone, so I'm Cassie from SCI Africa, and I'm going to briefly talk about one of the challenges facing the city of Nairobi, which is the pressure put on public spaces. So Nairobi is rapidly urbanizing. Currently we have 4 million, it has a population of 4 million, and 60% of which live in informal settlement. So one of the challenges of this rapid urbanization is that the rapid population growth combined with uncontrolled urban development put pressure on existing public spaces because they're being converted for other uses, like, for instance, like residential or commercial uses. So existing public spaces are not enough, are not accessible to everyone in the society. You have the issue of overcrowding, which is a result of unequal distribution and accessibility of public spaces. So for instance, you have high income areas which have well-maintained public spaces which are accessible, which are clean, but they are not accessible to the urban poor. And then on the other hand, you have informal settlements, high density neighborhoods with very poor and inadequate public spaces which are not well maintained. So there's the issue of accessibility. And now the existing public spaces are also being converted. So in general, in Nairobi, the issue that there's not enough spaces for walking, for cycling, for just recreation, and the existing ones are not accessible to everyone. So there is a need for urban planners in Nairobi and in Africa in general to think about how can you make these spaces more attractive, more accessible to everyone in order to improve the quality of life. So we are hoping with this initiative we can look at this issue of urban public space and how to make them more attractive and and more accessible to everyone. So thank you.
Hi everyone, I'm Pin from the Asia Center, and I'm also from Bangkok. So I was asked to provide some local context to challenges facing public urban spaces. And when I think about public spaces in Bangkok, it's less about green spaces or public parks, sadly, because we don't have much of those. For me, the most obvious public space is the sidewalks. If you've walked around Bangkok at all, you'll see an evolving cast of vendors throughout the day into the night selling noodles, barbecued pork, clothes, shoes, household goods, flowers for temple goers, and all sorts of other things. So the sidewalk is a zone of daily public interaction between vendors and pedestrians, but it's also a space of conflict. You might have heard about the recent ban on street food vendors in Bangkok. It made international news partly because of the concern that one of Bangkok's major tourist attractions was being taken away. And this conflict between the administration and vendors has been going on for over 40 years. It's not a recent issue. Each time the administration has these regulations, it's in the name of cleaning up the streets, clearing the sidewalks of obstacles for pedestrians because it's getting overcrowded, and for food safety and hygiene. And each time there are these regulations, there are protests, fines on the vendors, and even arrests. And this just shows that these sidewalks, they're not just for pedestrians. These conflicts occur because the sidewalks are also places where vendors make their livelihoods. It's difficult to say how many vendors there are in Bangkok, but studies have estimated that there are anywhere from 100,000 up to 300,000 vendors in the city. A lot of them are low-income people. A lot of them are migrants from other provinces and even from neighboring countries. When these regulations come out, there are few alternatives provided by the administration for them, and they find it difficult to adapt to bans and similar kinds of regulations. So there's impact on their well-being, but there's also impact on the well-being of pedestrians. So the customers of these vendors are usually lower income or middle income people, and these vendors provide affordable options for pedestrians who pass by. There was a study that said that anyone who was leaving the house to go somewhere, I think half of them would stop and buy something at a street vendor. So it's a place where they get basic goods and services. And so this is just one example where the city planning and regulations don't take into account the needs of all of the different kinds of users of an important public space. And they don't look at the full impact on the well-being and livelihoods of these different users. And it's not just exclusive to Bangkok. I think regulations on vendors have occurred in other Asian cities as well. So this is just one example to give you a flavor of some of the challenges.
Thanks very much, Kasil and Pin. That's been really helpful. I mean, just to elaborate on that, we were at a workshop in Nairobi 3 weeks ago, recently, and that appropriation of urban realm spaces by street vendors and how it impacts on other people's mobility and lifestyle choices was a big factor that came out in the workshop that we were working on. So this issue around sustainable urbanisation and the quality of infrastructure are inextricably linked. And this is one of the quotes I showed yesterday, but in slightly fuller form, showing or quoting Norman Foster, talking about how that quality of infrastructure is the glue that binds an urban centre together, and it's the public spaces, the bridges, the public transport, and the squares. That's what determines the quality of life for lots of how you experience the city beyond your front door. But these spaces at the moment, largely a lot of them are unplanned or not planned to promote health and well-being. So they're linked to unhealthy urban living. But I think there's the potential, if we can provide better evidence about how infrastructure is affecting health, well-being and livelihoods, that we can start to pull those levers in relation to urban planning to improve the urbanisation and sustainable urbanisation, particularly, as I said yesterday, in relation to this growing issue about mental health issues in cities and well-being. And that's one of the things we'll be talking about shortly. So at the moment, the way the initiative's evolving, just to keep you all in the loop, is we're thinking of 4 different activities as core focus for the first 2 years. One would be looking at this issue around urban forms and its impact on community health and well-being, and we'll see a talk shortly about that. Then this idea of co-designing urban participatory monitoring, so getting more crowdsourced data and information from citizens, both to inform their understanding but also to improve our understanding as experts. And how can we link that new learning into the kind of modelling that SEI is already doing to either, well, we'll harvest your ideas about how or what we could do with that. And then thinking about the governance dimension to all this, Johan and Johan have both been talking to me about the scales issue around governance in relation to this, so making sure that we can go beyond just very local governance scales, but actually start to influence at higher levels. But also for me, it's whether there's opportunities to use this new learning and the modelling outcomes, or whether there's barriers in the governance systems about how we actually use that information. So that's what we're kind of hoping to focus on. In this session, this initiative needs you. So at the moment, we're still at the planning phase. But what I'd really like out of this session, and why you've all got flip chart paper in front of you, is after each of the presentations, is to start thinking about who the boundary partners are in relation to that issue that you're aware of in the region. Are there particular opportunities based on your knowledge of local context that we could connect to? And are there additional things we need to be aware of that relate to what we've been talking about? So I'd like you all, between the presentations, to be working on the tables as groups and collecting that kind of information on your flip charts. And I'll try and move around, or I'll try and get Stacey and Casilda and Pin to move around to just make sure, see how you're getting on and facilitate that in some level. So has anybody got any questions before we move forward onto the first video presentation from Chris Neal?
Thanks. Just quickly, I wondered, when you mention health and well-being, what do you mean by well-being? Just because I think it's a really interesting, I think it's really important, but well-being is just so, like, covers so many things, and because then when we're thinking about social space, public spaces, and what you do in them, or even elsewhere in the city, that what does well-being mean for each individual is different, and of course there's a lot about socializing, entertainment, and those things. So
yeah. The reason I'm giggling slightly is I asked Chris Neal that very question about, try and put in some definition about what you mean about well-being, and I'm not sure whether he did it or not, because he said, let's just keep that a bit fuzzy for now. Yeah. So,
I just wish to point out that according to WHO, health includes well-being already. And I wonder if SEI perhaps should also use this definition.
well, I think that might be what Chris
It makes life easier.
I mean, I think you're right, well-being's a whole raft of terms. The way we've been using it in York a lot is in relation to mental health and the well-being around that. So within the medical profession, there's this continuum, if you like, between being unwell in terms of your mental health, and most of the medical approaches to it try and bring you back to a point of normality in terms of their interventions. But then within the work that SEI has been doing, it's more a case of, can we enable environments that can promote more of a transition towards flourishing in terms of your mental well-being, which can include that social dimension, social interaction, but also one of the questions that in relation to public realm spaces and public parks and those kind of issues is that interaction with environments and how actual environments can affect your mental state. So we've been doing work around that, trying to actually look at how different urban spaces affect you physiologically. And I think that's something that Chris is hopefully touching on in Work Package 1. Albert. Both good points. I'm not totally sure I'm going to give all the answers in this session, because I think part of this for me is harvesting those kind of key issues like you're suggesting. For the second point, no, I agree that rural communities are obviously growing as well. Is that what you're implying? But I think the focus probably for the initiative would be on more rapidly growing cities, where potentially the greatest population growth is going to occur. Does that kind of address what you... Okay, on that definition term, yes, I get exactly what you're saying. So in terms of the text that we've written so far, we are thinking of focusing more on those secondary growth areas for a variety of reasons, partly because of that growth dynamic, but also partly because they're potentially less well known, less well researched, and less well monitored in lots of contexts. And the information that local planners and decision makers have got in terms of the governance and management is often much poorer than those bigger cities that typically have got better monitoring systems and evaluation systems in place. Does that...
Hi, I had another question. I didn't see in these 4 themes anything on risk, vulnerability and resilience in the context of disaster risk, or natural disasters. And I think that's something we are really good at, and a lot of work is progressing. Not only, but a lot is doing here at the SCI Asia Center. So I was wondering, is that somehow covered, or has it been excluded?
So at the moment, my thinking is to try and focus the initiative on some very core areas, at least in the first phase, to build capacity across the different centres around these particular issues, and then to try and not from the beginning necessarily, but to build those connections to other areas of strength within the organisation once we've started to build some learning and some core competence around these particular topics. Just because I'm aware that the urban issue can be so broad and so all-encompassing, and it's finding a niche for what we could do, I think, within SCI that adds value to what other organisations are already doing, that we can that is a bit more unique for us. So at the moment I'm saying we're not directly linking, but we can talk about it. Okay.
Very briefly, I was just going to say that in the Science Advisory Council there was a discussion about the Urban Initiative a year and a half ago. And that was, so the advice was that, sort of, there's been so much done at the urban scale over the last several decades that we don't want to reinvent the wheel, but there was at least an understanding that there are some niche areas where SEI could really make a contribution and a novel way of looking at things, and that was the advice from them, that we should concentrate on trying to work out what they are, not try and do what everyone else has done.
Babette, and then we'll move on to a presentation, because otherwise I'm mindful of time.
Thanks, Steve. I just wanted, you mentioned earlier that mobility is an issue to be considered. I was wondering how it's being framed in this initiative. Is it a boon or a bane, or just an assumption that exists?
A boon or a bane? Is that what you said, a boon or a bane? Potentially it's both at the same time, isn't it? In that mobility can be the source of various different issues and problems in terms of congestion and risks and hazards for different users. But in terms of that access to services and potential for uplift in terms of education or access to healthcare facilities, or it can be a boon, I would say, in terms of urban systems. So I think it's just one of the, this seems to be the phrase of this science forum for me, the challenges that perhaps we should be looking at. But I'm going to allow Chris Neal, who obviously isn't here, but his video presentation, so we can think then more about that issue about well-being and how perhaps SCI could be looking at that in a unique way in relation to urban systems.
Hi,
Hi there, I'm Chris Neal from the York office. I'm just going to talk to you a little bit today about Work Package 1 of the Urbanisation initiative. So a few ideas around urban forms and their impact on community health and well-being. So Work Package 1 is interested in looking at links between health and well-being and urban environments. So health and well-being, it's a very kind of cool buzzword, very fundable thing at the moment. The definitions of it could be physical, could be psychological, and there's ways that we can assess both health and well-being through subjective responses and through qualitative responses. Which brings me on to the first study, which we're proposing for Work Package 1. It's building on a currently SEI-funded Seed Innovation project. There's a web link here which you can make a note of. That links you to a demo of what we've been doing and which you can have a look at. So what that is a questionnaire which we're looking at distributing around each of 6 centre locations. So that's York, Oxford, Tallinn, Stockholm, Bangkok and Nairobi. Participants, there should be 100 per site. We'll be answering questions about physical activity, about stress, about subjective well-being, and these are all established, validated scales that have been used in psychological literature for a few years now. But we're also giving participants an opportunity to qualitatively talk about their own environments that they live in and how, for example, air pollution, crime might affect them on a day-to-day basis. So that's what we've been working on now, and that should be finished towards the end of the year. So what this first study for the initiative would do would be to take those questionnaires and basically rerun them, but instead of doing them in these centre locations, we try and identify settlements or urban pop-up places that are kind of appearing, emerging at the moment, to try and understand if there's differences between an established urban population and people who are living in one of these kind of emerging urban settlements. So then we can kind of look in between. We can look between centre locations and within centre locations as well. So that would be the first port of call to establish this study method. And then we also use part of that to complement study 2. So the idea of these established urban spaces, there's a lot of literature in psychology at least, which suggests that there's preferences and there's benefits of green spaces, natural spaces, in terms of restoring attentional fatigue, and just basically being a bit of a health benefit. But what hasn't been established is whether this is true in African and Asian context. A lot of these studies are done in Europe, in America, a few in Australia. So it'd be interesting to see if there are differences and why those differences might be occurring. So we can ask subjectively, we can ask people to fill out some of these scales as per study 1, but we'd also like to take some objective stress measures as well. So the picture on the screen there is a shimmer device. It measures a galvanomic skin response, which is just basically a biological measure of stress. Increased sweating, for example, increased heart blood flow through the capillaries there around the fingers. We'd like then to have participants walk in between different types of spaces, within urban spaces, within natural spaces. And we'd also like people to be immersed in some of these spaces as well, so sitting down and just kind of taking it all in, but with these devices on. So we can understand an objective biological marker for each of these settings, and from that we can understand a little bit more about how established urban spaces are impacting on health and well-being. The last study is interested in stress as well, so we want to look at the biological marker. So in this case, we've got cortisol. It's a stress hormone which can be detected within saliva. There's been research done on this previously on the right hand side there, again in a Western context though. People who live in a high green space is the black line, and people living in low green space areas is the grey line. So what you're looking at on that graph essentially is that the flatter gradient is worse for your health. So it's associated with lower cortisol levels and a flat diurnal cortisol profile, which basically just means that people with these flatter signatures are more prone or experiencing chronic stress, which obviously leaves people open to more health problems. So what we like to do is basically replicate some of this research, but in an Asian and African setting. We'd want to take test sites within Bangkok, Nairobi, and a western location. Within each of those, we want to find residents who live in close proximity to a dense urban environment, and residents who live in close proximity to a green or a natural environment. Take cortisol measures, over 5 days. There'll be maybe 3 or 4 a day over 5 days, and then basically plot the cortisol for each of these areas and look to see whether there's a similar pattern to the Western context, or if there's something else going on, which we can explore in more detail. Well, thanks for listening. Any questions, you can grill Steve now, as I'm not there.
So those are 3 different options that we've been discussing in York about how we could build upon the seed and innovation work that Chris is funded for, but also the other activities looking more at those physiological measurements around well-being, so going beyond the qualitative to actually the biological reaction to urban environments. They could be deployed in the way that Chris has described, but they could also be used in other settings or around other issues if we think they're the more pressing concerns. So I'm aware of the time, it is now 10 to 3, but could we, on the tables at least, using the flip chart paper, get people's reaction to that opportunity, and whether there's particular places and issues and locations that people think that kind of work could be most useful for, and we'll try and capture that on the flip charts. Okay, I'm increasingly mindful of time, so I'm going to interrupt everybody. So I've been walking around and there seems to be lots of useful information being captured on most of the flip charts, and we've had an interesting discussion at the back about the relevance or the focus of this particular work package, which we can maybe reflect on or come back to at the end if we've not run out of time. But I'm going to move forward onto Rachel Pateman's presentation, and then we can talk about
Hi,
work
my name's
package
Rachel Pateman. I work at the SEI York Centre and I'm a researcher in biodiversity and citizen science. I'm going to be talking today about ideas for the Urban Initiative on how citizen science could be used to identify and monitor drivers of health and well-being in urban areas, and how data generated could be used to inform decision making. At SEI York, we've been using citizen science as an approach for nearly 10 years. Citizen science involves engaging citizens in various stages of the scientific process, including defining research questions, establishing methods, collecting data, and analysing and disseminating results. The aim may be to collect monitoring data, to test particular hypotheses, or to carry out surveillance. And the data may be used by the citizens themselves, by scientists, or by policy or decision makers. If well designed, there are many potential benefits to citizen science. A greater volume of data can be collected or processed than would be possible if researchers were working alone. Data can be gathered from people and places that are otherwise unreachable, marginalised or underrepresented, helping to ensure that knowledge and perspectives from a wide range of groups are captured. Engaging people in research can help to raise awareness of particular issues and encourage individuals to change their behaviour. And through participation, citizens can gain new skills and knowledge and the data and confidence they need to campaign on particular issues. So far, we've mainly carried out citizen science projects around environmental issues in the UK. However, we've recently worked with the Africa Centre to trial the use of mobile personal air quality monitors with residents of informal settlements in Nairobi to gather fine-scale information on air pollution. We're also working with the Asia Centre to engage people in quantifying the value of home gardens in Bangkok, and we're working with the US Centre and other stakeholders to explore methods for water quality monitoring in refugee camps of the Palestinian West Bank. The aim of this work package is to test various citizen science methods that can be used for collecting data, engaging citizens, and informing decision-making around issues that affect health and well-being in urban settings. The output will be a toolbox of methods that, having been tested in our focal locations on a limited number of topics, can be applied to other topics in other situations. The aim is that eventually this will allow multiple citizen-generated environmental datasets to be layered on top of each other, along with health and well-being data, in order to understand how different factors interact and to use this information to inform decision-making related to urban design. One element of the project will be to build on the co-created participatory monitoring approaches that we have begun to develop in Nairobi and Bangkok. This bottom-up approach will engage citizens from the beginning. We will hold workshops to identify the issues of greatest concern to citizens in relation to their health and well-being, whether this be transport, water, air pollution, access to green spaces, or something else entirely. We'll work with these groups to select one topic for a pilot project and to develop methods for data collection. If appropriate to the question at this stage, we'll also engage with policy and decision makers to ensure the methods we develop will produce data that is also meaningful to them. Data collection will be then carried out by the citizens and data returned to researchers for analysis. If appropriate, citizens will also be involved at this stage. We'll look critically across the process and evaluate how successful it has been in order to produce a best practice guide for establishing co-created participatory modelling. We'll also draw on the lessons we've learnt from our previous projects in Nairobi and Bangkok. We'll look, for example, at how effective the project was at engaging a representative cross-section of the population, the barriers to engagement, the practicalities relating to data collection, the quality of the data collected, and the success of engagement with policy and decision makers. The aim will be to produce a generic guide that could be used to establish similar monitoring programmes in other locations and on other topics. By contrast, the second element of the work package will be to take a top-down approach. We will engage with colleagues across SEI to establish the data gaps that exist for our models, such as WEEP and LEAP, and in other areas to establish where there are opportunities for citizen science to help fill data gaps. Again, we'll select one topic for a pilot project to develop and test methods for data collection. We'll aim to use the same topic for both study sites in order to establish how the opportunities and challenges differ between these two settings. Again, we'll evaluate the effectiveness of the approach in terms of data quality, ease of engagement and practicalities for data collection, and produce guidance on how to apply this approach in other contexts. We'll also explore the opportunities for engaging participants of the co-created monitoring projects to collect these other types of data. As well as environmental data, we'd also like participants to collect data relating to their health and well-being. Within this work package, we'll explore and test ways of collecting simple but meaningful health and well-being data from our participants. The aim will be to collect basic information to try to identify areas for more detailed research, such as particularly good or bad areas for health and well-being, and also data that can ultimately be layered with environmental data that is being collected to allow us to understand how these different factors interact and to produce recommendations for urban design. Thanks very much for listening to my presentation. I'm sure Steve will now be really happy to take any questions you have.
Okay, so once again, and I'll be coming around more rapidly this time, if you've got any reflections on what Rachel's just presented, that would be really good to harvest on the flip charts, and you can also ask me as I come around. So I'm really interested in harvesting your reaction to these potential work packages from the different tables. So if we spend another 5 minutes on trying to do that and capture that on the flip charts, that would be brilliant. Which one? The we can try.
And disseminating results. The aim may be to collect monitoring health and well-being. Within this work package, we'll explore and test ways of collecting evaluate the effectiveness of the approach
Okay, I'm liking the buzzing discussions that are going on at the tables, but I'm also mindful of not interrupting too much of the coffee break. So I'm going to now introduce Gary Hack, an SCI associate, long-time member of SCI York, who's now an associate, and he's going to talk about, related to work package 3, the potential of empowering communities through modelling work. So I'll hand over.
So, can I have your attention, please? Thank you. So what I would like to do here is to take some of the experience, some of the first two columns. Can you remind me again? The first two of the, yeah, none of the first two of the program. Okay. Okay. So what I tried to do here is to give an example of how we as an institute can apply some of the methods and experience that we've gained to one issue, and this is the issue of air quality. Now, I just want to reiterate what Johan said, is that I think it's important as an institute to understand what is our unique selling point. We have a massive experience, we have some methodologies. What is our unique selling point in terms of the methodology or experience we can use, but also what's the added value of addressing urban issues? What can we contribute that maybe other organizations have not yet contributed to? So, as you're probably all aware, air pollution is now a big issue. Just going back, SCI has a long history of air pollution work. We did transboundary air pollution for many years, and around 2000 we started to look into urban air quality. And what's interesting is that at that time we saw climate change overtake urban air quality as a kind of sexy issue. But what's happened recently is come full circle, and now with the UN, UNEP, WHO, air quality is back on the agenda, and air pollution, urban air pollution, but also linking it to climate change and short-lived climate pollutants. So here we know that the global burden of disease, that air pollution is a threat to human health. 85% of people in cities are now exposed to air quality levels that exceed WHO guidelines. In particular, since we're in Asia, if you see in 2013, 64% of deaths from outdoor air pollution were in Asia, and that is China and India. So in terms of the issue, air pollution is an issue, and it's something when we talk about urbanization, we have to address. So what I would like to do here is just to give you a possible idea that we could discuss based on the experience that we've gained over the years of community engagement, participatory methods, and applying it to the issue of air quality. And the objective really is to determine what works by working closely with communities to find out what they need and empowering them to propose solutions for lasting change. And that's important, lasting change to achieve better air quality. You could remove air quality, you could have put in another kind of issue. But here we're talking about air quality and clean air. So just to define empowerment, since there was a discussion about well-being, here this is a WHO definition, but basically empowerment to increase assets and attributes to build capacity in order to gain control. And the role of an external agent, which could be SCI, is to catalyze, to facilitate and accompany the community to acquire that power. So as I said, we've done an enormous amount of work in the past on behavior change. So, and there's different aspects of behavior. So first of all, we know creating awareness is important, but awareness does not necessarily mean you're going to get a change in behavior. So in climate change, people may know about climate change, but it's not important to them. And that's where the role of communication, presenting the message to specific target groups is important. So from awareness, then you change attitudes. Then yes, I'm aware of a problem, but it's important to me. And then that ultimately leads to behavior. And it's so important to me, I'm going to change my behavior, and I'm going to maybe reduce my environmental footprint or change the way I travel. So just give you an example, we did a project in York about reducing car use, increasing walking and cycling, and we did it over a year. We used different methods of engagement, and it was a great success. And then the money ended, and it was a great success. We were very happy. But then we thought, why don't we go back and see what happened a year later? So unfunded, we went back, and surprise, surprise, the behavior had returned for a number of reasons. Some people, like their circumstances had changed, they moved on. So the point I'm making is that it's not just about with the projects that we do, when the funding ends, you can say, yes, it's a success, we achieved a behavior change, but it's about sustained behavior change, and that's important. And to a certain extent, this is why this leads me to the second picture, is that what I feel is that in the kind of work we do with communities, we stop there. We don't take it any further. So you can, for example, you can say to somebody, I want to, when it comes to like individual actions for reducing your carbon footprint, to switching off lights, recycling, people may start to do that, but if the whole infrastructure, and this goes back to what we said earlier, locks you into a way of unsustainable kind of living or consumption, then you cannot change your behavior long term or sustain it if you're fighting against that. So what I'm trying to do is to do the second part of the bridge, and that goes to empowerment. How can we work with communities to not just raise awareness, not just to change attitudes and behavior, but go that one step further to, in some ways, engage with decision makers into a kind of form of activism where you can get change. Now, I'm sure you'll have lots of questions whether that is possible, but I'm just giving you an example here. So I have put this idea into a kind of framework approach, engaging communities, supporting the capacity of communities to respond to the issue of air pollution, but also supporting the capacity of agents to collaborate with communities and to respond to the needs. And here's the example of clean air. But there in the second column, these are all the kind of methods that we already do in SEI that we could potentially use. Focus groups, participatory GIS, we heard about citizen science, that's another thing, the modeling. So the idea is that by engaging communities, using the range of methods and experience that we have, whether then we can ultimately get to change that brings communities and decision makers together to actually apply in practice. So to change, it could be changing infrastructure. Now you could argue, well, that's not possible, or maybe it's very culturally specific, but maybe it's worth trying in terms of how we can do that and whether it can be done on a small scale in a small city. And it could be, I don't know, for example, work in a community who then go to their local authority who decide then to close a road or to pedestrianize an area because of the pressure that they put on of the evidence that they've collected. So it's really going that step, one step more than just, yes, awareness, attitudes, behavior, to really achieving long-term sustainable change and engagement. So in conclusion, I think SEI is uniquely placed to build upon the approaches and methods developed and experienced gain in community engagement and to apply this to community air quality management, that's what we call this, or to any other kind of urban issue. So on that, thank you for your attention.
So we've got a complementary talk to that as well from Dieter that follows on. So these are ideas from Dieter and Gary that are related to the third work package that we're proposing in the initiative, but they're kind of additional ideas alongside it.
Well, what I would like to talk is about a generalization of what Gary was presented, and also referring to what was said before. Next slide, please. So this is a simplified picture of what all is involved in urbanization. It is in the model of a driver's prefer, state, impact, and reaction approach, which has been developed by OECD and is being applied in many times by the international organization. You see quite a lot of things are prefers as a consequence of the driver urbanization, energy consumption, food material consumption, construction work, transport, rural migration, informal settlement, and each of these bubbles has also sub-bubbles involving, for instance, with transport, congestions and fuel adulteration and whatever. And then we have the state, that is deforestation, increased land use, change, greenhouse gas emissions, air pollution. Gary was talking about noise pollution. That is a very underestimated issue. Alone in Europe, 10,000 people die per year as a consequence of noise pollution. And that is something I think SEI has not yet addressed, except in my person. And then we have also indoor air pollution, waste production, water pollution, ocean pollution, soil pollution, and we have also disasters in cities, emergencies due to air pollution or other issues, and we have accidents due to transport. And all these issues influence health and environmental impact, and there must be some reaction on it. And I will end my presentation with the next slide, with a number of questions, how we can address the challenges of urbanization. But before saying that, just something in addition, what we heard about citizen science, that can also be what was applied mostly for air pollution, that can also be applied for noise pollution, for instance, or for water pollution. So the question that I'm asking, can we model the numerous interaction between urbanization-related pressure, states, impacts, and find the appropriate reaction to avoid, mitigate the negative impact of human health and environment. And I think some of the models are already existing at SEI, like such as LEAP and LEAP IBC, WEEP, LDP. But we have to turn also to a complex system management and develop eventually additional models. The second question is, what are the effective policy approaches, for instance, control, control and command, market mechanism to achieve this objective. And here I want to point out that implementation and enforcement and incentives in market mechanism are very weakly developed in Asia and in other developing countries, such as in Africa. The next question I pose is, how can we effectively develop incentives to change people's attitudes and behaviors to avoid and or mitigate the negative impact? And that is not only awareness raising and training, but also some approaches from the behavioral sciences, such as the nudge approach, but also others. And how can community empowerment contribute to that objective? And that is participation, organization, action, and all other kinds of initiatives which are partially already developed as SEI, but we should also tap in initiatives which are outside SEI. Thank you very much for your attention.
Okay, so thank you, Dieter and Gary. So just to clarify, at the moment, the third element of the proposed initiative is mainly focusing, I think, on how those first two activities around health and well-being and the citizen science generation of monitoring data, how could we feed that into the modelling processes that SEI already undertakes to work with cities and city problems? So particularly the systems like LEAP and WEEP around energy use and water management, and then Johann's work around the effect of air pollution on health impacts. So again, I know we're getting short of time, but trying to capture how you think that kind of citizen-generated information could be useful or used within our modelling processes, and how it relates. So I've had this discussion a little bit with Johann, in that whether it's a data input, which he's kind of suspicious of, but whether it could be a validation approach, or at least maybe highlighting where there's gaps in our understanding that the modelling needs to maybe be refined around. Is that, do you want to reflect on that?
Okay, so a smaller bit of context. You'll be probably hearing a bit tomorrow from Georgia, amongst others, about this application of LEAP that we're developing called the LEAP Integrated Benefits Calculator. So within that, we try and estimate health impacts of air pollution. And you can then link it back to the sources. And we're going to apply it in the urban setting, starting with Accra and then into Nairobi when we have done that. So how would that link to citizen science? Well, I think that we need to have more than a conversation over a coffee cup. So one of the problems is that the citizen science monitoring equipment measures particle numbers, and we need weight, which requires a much more expensive machine. But what we haven't discussed is, you know, things like carbon monoxide, which probably they can monitor with some degree of accuracy and things like that. So, you know, it's not a dead conversation, but even particle number is useful, but it's a question of how you can use it. So we have these tools, but tools are only, you know, rubbish in, rubbish out. So we need to have some way of validating whether they're any good, and, you know, monitoring is definitely one way of doing it. But exactly how it would all link together would need a bit more thought.
Hi, my name's Megan. I'm a new SEI intern. As for potential partners for this project, I know that Google Earth Engine is working with a company called Aquamoon, and they actually have developed cars that can monitor VOCs, and that's what they're doing right now to create actual real-time maps of where pollutions are in big cities. So maybe exploring partnering up with them might be an option.
Everything goes on the flip chart. So if anybody's got any other additional points like that, or thoughts about how this kind of co-generated information about how cities are functioning from citizens might feed into our modelling, again, if you can put that on the flip charts, if we can spend a few minutes doing that, and I'll hand over for Niall to talk about the final work package. Okay, if people can be getting their ideas down on the flip chart paper for us, that would be, including Johan's vision that I was hearing in the corner there. So get your vision on the paper, Johan. Get your vision on the paper. I'm good at that, trust me.
Okay. If you can get your last thoughts onto the pages, it would be great. We just want to try and finish up. I know we're running quite a bit behind time here, but the last kind of proposed working group for this is to kind of look at governance issues around urbanization and how we can support and influence any of the work that we're doing into the governance system and how we can have more inclusive governance decision making. So I'm very conscious of the time, so rather than trying to explain everything we've done, I think there's been enough talk about governance issues, there's been enough talk about inclusiveness and equity in the decision making. For us now is just to quickly get 2 or 3 minutes on kind of the following 2 questions for us. Sounded terribly like it going actually. But just looking at if you have any experience from the areas that you're working in, the cities that you've worked with and all the rest, if there are any particular governance structures that can accommodate this type of participatory data and that can take it on board, that will listen to it, that will embed it into its decision making, can you try and write down examples of where you've seen that so that we can follow up on it? One of the things that we'll do in the early stages is to look at a kind of a literature review of any of the governance systems to see what's possible out there, where that has actually worked. But if you have any ideas where we should try and focus our review, just try and put that down on paper as well. And then the second part is how do we feel that SEI can support existing governance structures both in Africa, Asia, where the focus of this program is, to accommodate this participatory data. What is it more that we can do? Beyond examples that you might see, what do you think the SEI can do further to try and help integrate this material into the decision making? Just try and think through some examples that can help us focus where we go moving forward. So again, between now and 5 minutes and your coffee break, jot down a couple of ideas, please. Thanks.